We will now go on to Gabrielle Peters, who is a co-founder of Dignity Denied. Ms. Peters brings a deep understanding and an analysis of intersections between poverty, ableism, and MAiD. Ms. Peters is being assisted today by Spring Hawes, also of Dignity Denied. Ms. Peters.
Thank you and good morning, Senators. I'm here to speak on behalf of Gabrielle Peters. I will read her statement. I'm here this morning on the unceded territory of the Silks Nation in the Okanagan area of British Columbia. On behalf of Gabrielle, I'm here today to testify about my knowledge and to share my experiences and maybe answer your questions if you deem me worthy of any. But I hope that you will forgive me if I also pose some questions of my own. Having watched the Parliament and Senate proceedings on Bill C-7, and having lived in this country as a disabled poor woman, particularly during this pandemic, I already know how little value is placed on my knowledge or my experiences or even my life. I don't arrive here expecting to say I suffer and have the Canadian state turn and ask, how can we help? Because that is not my lived experience. I did plan to come armed with statistics and analysis and a theoretical framework and some Canadian history and hopefully some humble reasoning skills. I thought I might have time to discuss the conflating of liberty with autonomy and the lethal consequence of policy that denies interdependence and flattens the us that is Canadian society to white, wealthy, and non-disabled. I would have liked to discuss why a lethal injection of chemicals by a doctor has been branded dignified. And perhaps I'd have asked whether you'd given any thought to the manipulative, coercive effect of the branding. Decades of dire warning about how old and disabled people were going to burden our healthcare and society has been matched by marketing MAiD as a heroic, brave, self-sacrificing, and honorable death. You'd be shocked at the number of times I've been called selfish for wanting healthcare by healthcare professionals. What is it about this particular demand that makes the Canadian state bend to fully fund and deliver their wishes, regardless of the harmful impacts it will have on a protected class? Is it the prospect of cost savings? Because I know the government commissioned a study and found that there would be some, but it only considered MAiD versus end-of-life care. Imagine the cost savings of causing the early death of a disabled person who is not dying and has decades of healthcare and possibly income and other supports ahead of them. If it's not the cost savings, then we are left with ableism versus the rugged individualism Canadian myth, the rugged individualism that is supported by a piece of plastic. The phrase "on their own terms" is slightly foreign to me as a disabled poor person. I can't even cross the street at 8,000 of the 27,000 corners in Canada's third largest city because they haven't been ramped. I live in a unit that was assigned to me. On the day I moved in, the movers had to wait while the police, then the coroner, and then an ambulance used the elevator, because this is how people here move out. My wheelchair seat cushion has a tiny tear in it, and I know this because I deal with incontinence, and when I wiped the cover, I discovered the foam was weighty with the fluid it had absorbed. If I had money, I would go online or pick up the phone and a new cushion would be on its way and I would go on my day. The problem would be handled by me, or actually by my money. Efficient problem solver could be my brand or at least a line in my resume's cover letter. But I'm poor. So a new cushion means applying for funding. And to do that, I first need to book an appointment with an occupational therapist who will be paid to say what is already obvious, that I need a new cushion, or at least I hope she will. After that, a chain of events that, if it goes smoothly, and it never does, includes documents exchanged between the OT and the ministry and the government vendor until a new seat cushion can finally be ordered to me. This can be weeks or even months of sitting with the smell of stale urine. We do not need to build a laboratory to discover how to end the suffering of poverty. We know how to end poverty, and we just don't do it. Why have press releases about reconciliation? Why have press releases about reconciliation and racism beside press releases about a Bill C-7 that seems to violate the spirit of one and perpetuate the injustice and harm of the other? Were the words spoken here by the Indigenous leaders and by Black disabled people and disabled people of color few though there were, not sufficient? And if they were, why is a single MAiD provider testifying that she is 100% confident about the abilities of 100% of her peers in 100% of the situations to be able to operate 100% free of bias and with 100% accurate assessment, treated as credible evidence? In 2009, before MAiD became law, I was admitted to a hospital in Vancouver. Several years earlier, a rare autoimmune disease had set in. Prior to that, I worked, and prior to that, I was a university student who also worked. I had worked my way up from poverty and was on a path to secure middle class. And then I got sick. A day or so into this admission, I found out that my partner was leaving me because he didn't want a future with a disabled woman. Because I no longer was working, and because his income was too high to allow me to receive my own support from the government, when my bank account emptied, I became his dependent. And now he was leaving and I was homeless. It was at this very moment that the hospital sent someone in to console me. They'd heard the news and that they were very sorry. She passed me a tissue and said I had been through so much and I deserved a rest. And then she produced a DNR. When I refused, we went back and forth until the charade of concern was dropped, and she shouted, "I don't even understand why you would want to go on living." I know that MP Garrison has suggested weight not to be put on these words because I didn't report them to a self-governing body. But the thing is, I tried and no one would return my call. I didn't have a computer or visitors, and I was bedridden. You think you have all the answers and that you can tie this bill up in a bow. But the truth is, you know nothing of the lives of the people who you are putting in the crosshairs by deluding yourselves that you can amend away the danger. Kill Bill C7, or you will kill disabled people.